Hospitals are experimenting with telehealth services and working to integrate care coordination during COVID-19 to provide better care for their patients. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Netterly, Senior Writer with AHA. This podcast is a three-way discussion of COVID-19's impact on telehealth and integrated care. Our moderator is Priya Bathija, Vice President of the Value Initiative at AHA, with guests Carol Vargas, Vice President of Integrated Care, and Dr. Sylvia Romm, Chief Innovation Officer, both with New Jersey-based Atlantic Health System.
Thanks, Tom, and thank you, Dr. Romm and Carol, for joining us again to talk about telehealth and integrated care at Atlantic Health. The COVID-19 pandemic has challenged the healthcare field to reinvent and reconnect. I'm really looking forward to hearing how you have created new ways and tools to provide care and reach your patients and community members throughout this pandemic. Dr. Romm, can we start with you, and can you share how Atlantic Health has been able to use telemedicine and virtual tools to support the needs of your patients during COVID-19?
Yeah, absolutely. I mean, I think that, as probably your listeners know, Atlantic Health is in northern New Jersey, and so we had some of the effects of New York City being the epicenter, and so New Jersey was really the second hardest hit state in terms of COVID during this pandemic so far. And so we saw a rapid uptick in not only in the number of people who are affected by COVID, but also people who were interested in accessing care in ways that didn't require them to come in physically to the locations, to the clinic locations. And so we went from doing a handful of visits a day, a handful of virtual visits a day, to, at our peak, over 3,500 virtual visits between all of our sites, which obviously is a huge jump and a massive change, not only in practice and experience, but also understanding the technology infrastructure. And so we implemented a bunch of different tools. And we also realized that with the speed that we needed to change the way that we are practicing or support the way that our providers were practicing, that we needed to, as a system, take advantage of a bunch of the waivers that the federal government had put forth in terms of technology. And so in addition to moving forward our roadmap on the sort of health system-wide infrastructure, we also helped support the providers in using some more consumer tech technology that allowed them very, very quickly to scale up to meet the needs of their practices and their patients to be able to deliver that. And so it's been a wild time, especially for somebody like me that's been practicing with telemedicine for years and has really been a champion. Now all of a sudden I have thousands of my colleagues that also have a significant amount of experience of practicing with different modalities. And so it's been very interesting to see that transformation.
Thanks, Sylvia. That is really cool. Carol, on our last podcast, you talked about your care coordination team. How has that helped as you address COVID-19?
Oh my gosh. So our care coordination team, I am so incredibly proud of the work that they've done and how they responded. When we started seeing the cases emerge, and even before the cases started to appear in New Jersey, but in anticipation, a lot of the conversation was focused around how do we protect, really protect the capacity of the healthcare system. That's really what, a lot of the work that we're doing in social distancing and flattening the curve is all about, right? Which is how do we actually make sure that there's enough healthcare capacity in place to care for the people who really need that level of care. And so we frame that in terms of how are we protecting the healthcare system capacity? And we can only do that by ensuring that patients are able to receive and access the right care, the right time, the right place. And so with that kind of goal in mind, or that sort of true north driving us, I think we had set up 3 initiatives that I think were very impactful and really made a difference. The first thing that we did was we opened up a hotline, a nurse hotline that was available 7 days a week, from 7 a.m. to 7 p.m. And we stood this up really early when there was very, very little information really out and about COVID. It was a time where I think the communities were starting to feel panic and not sure where to go for their care. There is a lot of questions about, do I have this? Where should I go? How do I get tested? And at the same time, the provider practices were actually trying to figure out how to deflect some of this volume from coming into their offices because they may have lacked the PPE. They were, looking to not, encourage or not to allow the spread of the virus. And so one of the things that this hotline did was it really just triaged a lot of these concerns, and it gave patients and community members a place to go to with their questions. And it was really important because in the beginning, this deflected a lot of the questions that were going into the emergency department. So, the emergency departments were so busy trying to take care of the patients that were starting to come in with symptoms that they didn't really have time to handle the volume of calls that was coming in. And at the same time, they were also able to help patients that were looking to connect with a provider. So that actually evolved over time to a place where we connected with our medical group, and the nurses would screen and triage a patient, and they would really determine what's the right site of care for that patient, whether that patient should stay home and treat their symptoms. And frequently, and in the majority of cases, that really was the right place and the right care for that patient, was just to stay home and manage their symptoms. If the patient was screened to be high risk, they had a warm handoff to one of our physicians who would then do a clinical diagnosis. And in the early stages, that was done just over the telephone, but as time evolved, the program really got to a place where the nurses could screen and triage, do a warm handoff to an actual televisit, and through that televisit, the physician was able to order some testing, and it was a really streamlined, pretty completely digital process, which was really cool. The other project that we worked on was something called Observation at Home. And that way, again, with the idea of how do we protect capacity, or how do we make sure that patients are using the right level of care, the Observation at Home program was for our COVID patients in the hospitals who could be discharged. They're at a higher level of acuity of care, but could be discharged if they had the right care packed around them. And so we set up a program where they were discharged with a remote patient monitoring system. They were sent home with the DME, so they had oxygen delivered to the house, they had a pulse oximeter delivered to the house, and it was this well-coordinated program where the next day they would have a scheduled televisit with a provider. There was also a nurse, whether it was one of our transition nurses or a home care nurse, who would do twice-a-day video check-ins with that patient. So what that actually enabled us to do was take that higher acuity patient and discharge them to home. It actually helped us make home the right level of care. Traditionally, without that program, that patient would have had to stay in a hospital bed for another couple of days, and so we were able to create that capacity. And the last thing that I just have to say that our care coordination team did that was really incredible was we also have social workers and community health workers on our team, and they played a really integral role in helping people make sure that home was the right site of care, whether it was ensuring that groceries were delivered, they were picking up medications and leaving them on patients' doorsteps. If there was a piece of equipment like a pulse oximeter that a patient needed, they really made sure that they had the social support and the behavioral health support that the patients needed as well. So that was really terrific.
That is really terrific. And, as I'm thinking, I just thought of another question. When I look at what you've accomplished at Atlantic Health, both in terms of telehealth and care coordination, you had a lot of the right pieces in place before the pandemic even hit. Is there anything that you wish you would have had that you didn't already have, or you would recommend that other hospitals most definitely implement because it's something that really helped you get through this in a way that you wouldn't have been able to otherwise?
I don't think that there's something else that I wish we had. I think what really worked for us, and that it's something that we're all reflecting on now, is that I think that most health systems have the elements or the ingredients in place. But what we saw going through this pandemic was that we worked with different teams better than we ever have before. So in that last example of observation at home, we have a DME group, we have a medical group, we have some telehealth technology, we have home care, we have nursing. But, what I think happened in this pandemic, and what I think probably, I would hope that this is the experience of a lot of health systems, is that the teams really did come together in a way that we call like that one system. I think most places have those ingredients or those departments in place, but the ability, how this crisis brought us all together and working towards a common goal, I think is something that is going to live well beyond COVID. Like we developed a lot of things, just there's so many barriers broke down or so much fragmentation that can exist within a large health system, really just dissolved. And I think that that's something that's going to last with us beyond this particular crisis.
Yeah, that's a really good point. Dr. Romm, anything from a telemedicine or virtual care standpoint that you think was critical as you took this on?
Yeah, so just to put this in a national perspective as well, I think that there were a lot of changes that happened on the federal level that allowed for there to be aligned incentives, allowed for barriers that had been in place for using different modalities of providing care, like video and some other modalities that were changed during COVID. And I'm getting a lot of questions now of what does this look like in the new normal? Like how has care changed? How will it change? And there's a lot of individual practices that have changed, which I think are very important, but really understanding that there is this larger world that our healthcare delivery lives in, and how we continue to do care is impacted by these national and federal guidelines and regulations. And so right now, I think that the lack of clarity in what's going to remain in place in terms of reimbursement, what's going to remain in place in terms of, for example, licensure restriction loosening is going to be very important in how we think about developing care over the next years and how we develop relationships with patients over the next years. And of course, I personally am in favor of keeping a lot of the waivers in place because I think that we've seen now that we can provide care safely under this environment, and that we have a lot of very good outcomes. But also getting clarity as soon as possible on what it's going to look like is really important as we start to build out the infrastructure that we plan to use over the coming months and years.
I think that is a really excellent point, and I'm glad you made it because I think that clarity and the lack thereof of clarity is causing a lot of questions for our health systems as they think about life after COVID or even throughout the next year with the COVID pandemic. So I'll end with one last question for both of you, and that is, what do you anticipate will change in terms of value and the conversation that we've been having and sort of the pressure on hospitals to lower cost, improve outcomes, and enhance the patient experience? How do you think that's going to change?
From my perspective, this is Carol. From my perspective, I think that the conversation around value and access becomes more important than ever. I think based upon the experience that we've just had over the past 10 weeks of going through this pandemic and its peak, we've built so much infrastructure in place. I think I've heard many health systems and colleagues say we've built in 5 days or 10 days what would normally take 2 to 3 years. So we now have this opportunity where we have this new infrastructure in place, and a lot of it is directly attributed to what Sylvia just mentioned with the relaxed regulations and the new waivers in place that allowed us to do so much so quickly, that I think now more than ever we need to lean into value. And I know as a system that's certainly our plan. We've got this great opportunity of infrastructure to lean upon in terms of creating new access to care with our telehealth solutions, new innovative ways to deliver care. So I think that our ability to be successful in value looks really bright. I also think that given, where we anticipate this new normal, what does the new normal look like, not only within the health system atmosphere, but, what's the current situation and the current climate of our country, and seeing current unemployment rates and understanding that we're going to have economic hardships ahead of us as well. I think it's more important than ever that we commit to delivering care in a way that is safe, accessible, and also very affordable. So I think that's the challenge in front of us, and I think that value is probably the way that's going to get us there.
Thanks. And Dr. Romm, I'll give you the last word.
Yeah, no, I agree with Carol wholeheartedly. I think that one of the challenges we're going to have to navigate in terms of the value-based world, and specifically with looking at how we understand finances, is that anybody who is trying to calculate what we think we should be spending or what we think we can be spending on certain populations has had to completely redo their calculations in the time of COVID. And so it's a challenge that we are going to have to face as we move forward and think about how, as a health system, we want to take on, more of the insurance risk. How do we think about that? How do we look at historical data around claims and what kind of care people have used moving forward? I think that it's certainly a challenge that we can meet, but recognize that it's certainly upended a lot of calculations to this point, and so we're having to really put our heads together and think about how we can do that best moving forward.
Well, thank you, Dr. Romm, and thank you, Carol, for joining us again to follow up on your previous podcast and really tie it to the experiences that you have had in addressing the COVID-19 pandemic at Atlantic Health. Thank you again, and have a great day.
Thank you.
Thanks.
To learn more about Atlantic Health System, listen to a previous podcast with Priya Bathija, Dr. Sylvia Romm, and Carol Vargas. It's titled Connected Care Improves the Patient Experience.